Well, hello and welcome to Ask the Doctor. My name is Jerry McGee and I'll be your host for today's show. We're here at Wellness Associates in Pittsburgh, Pennsylvania with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time. On today's episode, we want to talk about something that I think maybe people haven't even heard of yet. It is kind of unique, but we had a viewer write in where they were having chest pain. They went into their doctor, they ran all the tests, and the heart and everything came back, everything was good. They had no problems whatsoever, so they were glad to hear that. They said, well, it's probably an acid reflux, problem, and they gave them some pills for acid reflux. And they're concerned about should they, get a second opinion. Is there anything that you might look at differently than they did? And they just kind of wanted to know what would your advice be in that situation?
We look at it as, why is she having the chest pain? If it's caused from acid reflux, that's all well and good. She's on a prescription. Could be from a hiatal hernia, we can adjust it. A lot of times, Jerry, it's coming from a thing called spinal angina. Basically, it's a pinched nerve in your spine that's relating and referring into the chest. It's causing a real symptom, chest pain. It's not coming from the cardiovascular system. It's coming from your brain and your spinal cord. It's called spinal cord pressure. It's a pinched nerve. So what we do is we look for any pinched nerves. Like, a dentist would look for a cavity in your teeth. We look for pinched nerves in your spine. We relieve the pinched nerve, we relieve the spinal cord pressure. 9 times out of 10, that frees up that nerve. That nerve's not causing referring pain into the chest pain's gone. Okay, they don't need the acid reflux pill. They probably don't even have acid reflux.
Right.
Okay, so as we get to the root cause, if it's coming from a pinched nerve in your neck or coming from a pinched nerve in your back, that's referring into the chest. That's causing a real symptom, angina, but it's not coming from the heart, it's coming from the spine.
So that, if they notice, and I'm just kind of thinking as we go on here, but that pain that maybe is kind of a, not all the time, but off
Comes
and
and
on,
goes.
okay, that would be a good,
Yeah.
because they've had a good check there,
Yeah.
but they keep irritating that nerve and that pain just
Yeah.
kind of keeps cycling.
Because 90% of your nervous system is silent. So therefore, if it's hitting that 10% critical sensory part of your nervous system, that's going to cause a pain. So when it hits that critical part of your nervous system, that's your body communicating with you. That your body's your friend. Your body likes sticking around this planet, Jerry, just as much as you do, and it's trying to survive. So it's communicating with you. And so we say, listen to your body, okay? And so what we do is find out why you have the pain. In my experience, 9 times out of 10, it's coming from the spine. That's why there's a new classification. It's called spinal angina. You're going to start hearing more of this in the future.
Yeah, if you haven't, before this, I hadn't even heard of that problem, but I think I know enough people and have heard enough that I could see where that's coming from, because
Yes.
a lot of people complain about, oh, I've got that, that pain here, and they automatically think it's from the stress in the heart and all that
They
kind
go to
of
the
stuff.
hospital, they do the EKG, they do the
Right.
echocardiogram like their caller called it.
Yeah.
It's not coming from the heart. It's all negative. It's
Right.
coming from your spine.
Right. So they end up really adding a lot of charges onto the healthcare system.
Got that?
When really, I mean, if they would have come in, had an evaluation, looked at, relieving that nerve pain, you could have taken care of that problem at a fraction of the cost.
It's something simple. A
Yeah.
lot of times truth is simple.
Yeah.
Okay? So that's what we do.
Well, as you're watching this video, what we want you to really understand about chiropractic care is that, one, I know in the past everybody, was, I'll crack my back or crack my neck, and that was kind of what chiropractic meant, but there is a lot more to the practice of chiropractic that people don't understand.
We take a holistic approach. We
Right.
treat the whole person. I don't know if you know this, Jerry, but we can actually treat any joint in the body except for one thing, your nose. So we can treat your shoulders, back, the whole body. It's like total body modification. We can treat the whole body. And people just think we're back doctors. Yeah, we look at the back to get to the nervous system. Why? Because we're nervous system doctors.
Right.
That controls your body.
Yeah, I think a lot of people are just, they always think, well, I didn't realize that problem would be, good for chiropractic care. So what we want people to understand is that any problem that you're dealing with, chiropractic care can have a great impact and a positive impact on your problem. So if you've been dealing with this problem and going back and forth and not really getting any results with your medical doctor that you're going to, you need to feel free to pick up the phone and call Wellness Associates. I know Dr. Goldberg offers a free new patient evaluation. So you can come on down, meet the staff, meet Dr. Goldberg, go over what your problem is, let him explain how chiropractic care can make an impact on that problem. I think you'll be amazed at the results that you're going to have, and really the time that you're going to save, and the pain and anguish that you're going to,
Right.
that you're going to save. I mean, our goal with this program is really to get people educated on, how important chiropractic care is, looking at the total body function, and just understanding that we have to take an active role in our health. It's up to us to make these, changes and ask these questions. And don't be afraid to, tell your doctor that, hey, I'm going to see Dr. Goldberg, a chiropractor, to kind of aid me with this problem. Because, my opinion is, and I've said it many times, if your doctor is concerned about you getting a second opinion or visiting a chiropractor, you need to find a new doctor. Okay? I mean, that's not Dr. Goldberg saying that, that's me saying that. Because I think too many times that's the way people deal with their health. They're more afraid of what their present doctor's going to say, or he doesn't want them going anywhere else for any other
That's
opinion.
ridiculous.
Right,
That's ridiculous.
but they never feel, because they don't feel as comfortable with their own skills and the results that they're giving somebody. So they don't want second opinions. Our role, and it's your health and it's your body, you need to take that active role, make your own decisions, get educated on the problem. Visit AskDrGoldberg.com. A lot of great free information there from our blog posts and videos and all that you can review. But more importantly, you owe it to yourself to pick up the phone and give him a call and come on down and just see firsthand what he can do. And give him a shot to help you with your problem. I think you'll be amazed at the results that you're going to see, and you'll be a chiropractic fan for life, just like a lot of the people that come down here. I mean, it's a life-changing situation for you. It aligns that body, allows your body to function at a much more efficient manner, which allows everything to work better. So with that, we just hope you enjoyed this video. I found it informative. And we really look forward to, I know Dr. Goldberg looks forward to meeting you firsthand and kind of sharing some of his knowledge with you. So pick up the phone, give him a call, and just we hope you have a tremendous holiday season, and we look forward to seeing you at Wellness Associates.